Washington, D.C. as well, and Washington is a place where testing has just not been broadly available. As we look to that next chapter of testing, which is to see who's been infected, antibody testing, et cetera, have any states shown a capacity to test broad-based, as Poppy was referencing there? In other words, to have capacity in the next phase that they clearly did not have in the first phase of this?
Right, you bring up a good point. So when we've taken a look at pandemic response in the past, and we in the disaster medicine and emergency management world have been looking at pandemics for decades. When we have tried to figure out the best way to both test and to eventually immunize people, we've taken a look at how to recruit people to help us in that process. There's this whole concept called the Medical Reserve Corps, which is a group of volunteers, several of them in different states, where we bring people in and teach them the basics of public health to where we can do contact tracing. And contact tracing is going to be very important going forward. You know, this great paper out of Johns Hopkins earlier this week estimated the need for maybe 100,000 people to be brought into the public health sector to help do contact tracing. So we take a look at the need of people there. But even further down the road, say a year or 2 years from now, when we finally have a vaccine, how do we distribute that widely to 320 million people? You can't just send 320 million people to their doctor's office to get an injection. So bringing in these groups like the Medical Reserve Corps across the United States to help distribute those vaccines has been a plan for many, many years, and it may be called into service for this.